my God. Oh my God.
She's just faking. She did this yesterday. They called it like breast mix or something.
Please help me. I
You're
need
gonna be
an
fine.
epidural. Please, I need an epidural.
You're gonna be fine. Don't worry.
Oh my God.
The baby's not even due till tomorrow. It's
Oh my
fine.
God. Did you call my husband?
No, I forgot something. Oh, okay. We'll call
He's
him.
in this. I need to kill him.
Hi, what can I help you with? What's going on here?
I need an epidural, please.
You do? You came in for an epidural?
Yes.
What else do we have going on?
I think I'm
Patient
gonna die.
33 years old. She
Oh my
diagnosed with
God.
adequate abdominal pregnant. Based on our primary assessment, it's a stalled pregnancy. Contractions last
Oh my
45
God.
seconds each, 3 minutes
Oh.
in between.
Oh my goodness.
Said this is her first pregnancy. It's a
Oh, I
Carol
think I
1.
have to poop.
Is it gonna smell?
That's
Can I go poop?
Not yet. Just wait. Go to the bathroom.
Okay, pulse with 84 beats per minute, respiration 18 times per minute, both regular. So you can find that and that EEG.
See, you're
She
fine.
said
I told
very-
you you're fine.
No, I'm
Very
not.
first pregnancy, Carol 1, Vita 1.
Okay, very good. What's your name?
My name is Kira.
Kira, hi, my name is Annette. How are you today? Other than having a baby?
Yes.
How many weeks pregnant are you?
Wait, tomorrow?
She's not due till tomorrow. She keeps saying she's gonna have a
Oh
baby
my
today.
Oh, okay, well,
Oh my
we'll see.
God.
Maybe she will. Okay. So Kira, we have stable vital signs. Is that what I heard here getting a report? Okay. Kira, did you do any prenatal classes?
No. I didn't have time for that.
Oh, okay.
Oh my
Tell
God.
me, do you have time to pick out a name for the baby?
Did you think of one yet?
No.
Oh, what are you waiting for?
Oh my goodness.
My sister, she takes forever for everything.
All right, well, let's take a look at you and see what's going on, okay?
I feel like I have to poop.
Oh, okay. Well, don't push.
Oh.
Please do not push.
I need an
And don't bear
epidural.
down and have that bowel movement. Let's just take some slow, deep breaths. So, have you had a child? Have you been in this situation?
No, never.
Okay, so what I want you to do then is to stay near the head of the bed with your sister.
Okay.
I want you to help her stay relaxed.
Just relax.
And we're going to see if we can do that epidural for you.
Please.
Perhaps you might have enough time to do an epidural, or maybe you won't.
Or maybe you won't.
No. We'll do it tomorrow.
Oh yeah, labor delivery.
No, I'm sorry. You need to sit
Today.
down.
Oh,
We're going to just take a look and see what we're going on. You got to for that? She can help you out. So let's get you on the strap. Before we move you to the bed, we're going to take a look. There's some gloves in there too. We're going to take a look and see what's going on. All right. So I want you to take some slow deep breaths. No pushing. Okay, we're going to take a look. I know.
Don't
but
move.
just
Don't do it. That's
okay?
gross.
I want you to focus. Go to that happy place, maybe on the beach. Okay? All right, so we're going to check to see, did you have a gush of water?
Yeah, I think so.
You think so?
Pop.
Oh, balloon pop, that's good, okay.
She said she peed her pants on the way here.
Oh, okay, so we have
Yeah.
clean pantses.
Yes.
Focus on your
Shopping.
Look at me.
Look at her
You're
face.
fine.
Right.
Call my husband.
Yeah, he's gonna try and come. He's gonna try and come. Yeah, look at me. Look at, you're
We're
fine.
just going to check the amniotic fluid, the water. Oh, it's nice and clear here. Do you have a nitrogen?
Oh, see, it's clear.
Okay, let's check that. It's, it's positive, your water's broke. Okay.
Yeah, oh, you didn't pee your pants. I knew
No
it.
pants for you today. So we're just going to have you put your legs up here. We're just going to check and see what we're doing here, where we're going.
So that is very common. A lot of women do think they need their pants.
Alrighty,
I
so,
read that on the internet.
oh, well, I think we're going to have a baby. That's
Oh, there it is. There it is. You found it.
Has it started?
I think so.
Okay, take a deep breath. Take a deep breath. I want you to bring your shoulders up here, put your chin to your chest, and I want you to pull behind your knees. And
How about your knee?
Go ahead. Push, 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 push. No noise. No vocals. Just push. Okay. Take a deep breath. Let's do it again. Stay on top of it. Come on.
Push, push, don't wait.
Rock.
Get it out.
Don't lose the contraction. Push the chin
Finish
down.
trying to get real push.
That's it, do it, push, 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 push,
Okay,
push.
we're getting somewhere. We need.
Okay.
Oh, we have. It's starting to. Let's go. Take a deep breath and relax. Take a deep breath and relax. Just relax. Let us know when the next one's going to start. Okay.
Oh, pushing, we're pushing. There it is, there it is.
It's
fine.
We got.
It's all swinging.
You got a baby. Are you gonna breastfeed?
It's all dirty. Oh, let's just like you. Yeah, just like you.
I have to deliver the placenta?
Yes, you know. Yes.
Oh my Lord! I was gonna kill him.
So we're doing this again, right now? Okay.
I think so.
Oh, there we go.
Right?
Push, 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 push. Push your faster for that.
Oh, the bucket?
Yeah, here's your bucket.
What is that?
It's the placenta bucket.
Oh, you've got a bucket.
Oh, you have a bucket. All right, take a deep breath. Let's go with the next contraction.
Right, that's a good sign. You like it when they cry.
He's got a full set of lungs.
Let's get the moisture off the baby. Okay, we're checking the heart rate.
Right, laxos.
Oh, nice heart rate.
Yeah.
145.
That's a good.
Count for 4 minutes. Okay. Let us know when the next contraction is.
I'm ready.
Okay, go ahead, bear down and let's push it out. Last piece. There we go. A nice,
Ooh, look at
nice
that.
lovely placenta.
It's shiny.
Looks like it's all, the petals are all
It is.
intact.
It's shiny.
All right. Do you want to cut the cord?
I would love to.
Okay, there you go.
Snoop. Oh, we forgot to take a selfie.
Oh no!
We talked about this the whole way here.
Oh, yeah. Serious life if you're not self-emotional.
Okay.
Okay.
All right, is this still?
No, it's the
It's
detach.
fresh?
It is fresh. Let me get the rest of the cut cord.
So, Mrs. Swan, can I take a picture of this?
Go right ahead.
Okay, and I'm gonna post it to Facebook. You know what's gonna happen? What? We're gonna get,
Go ahead.
we're gonna get kicked out. What is that called? Not suspended. What's the word?
Expelled?
Expelled.
Why?
Why? Because non-complaint that it was a violation of our HIPAA. And all, you, me, and the other two nurses here all got expelled from school. And we took it down right
How am I
away.
gonna pay my bills?
Yeah, well, that was a problem. Now we need a lawyer. And it'll take
Where are
like,
we gonna get a lawyer?
Well-
I can't afford a lawyer. I can't afford to go to school.
the school.
I'm a poor student.
Okay, but what's gonna happen 3 years down the road is 2 of us will be on different career paths, never to return. And 1 of us will soon get readmitted to the school where we violated policy. And then we'll have 3 long semesters with a lot of very unhappy nurse educators. So, note to self. No pictures. And that's a true story. You can look it up on the internet. Those students.
When you're in clinical, no cameras at the hospital.
When your students were expelled, they took a picture of the placenta. They had the professor's permission. They were expelled. And they had to sue, and 3 years later, one of them did get back in. I don't know about the other 2. So, please don't do that.
We just put the placentas.
We save them, we play with them, yeah, no pictures.
You can
Okay?
touch, you can play. what we're gonna call her, besides to be Wednesday?
Wendy Wednesday.
Maybe Wednesday.
So we're gonna talk about a couple different issues. This is kind of an open forum for you to ask questions. But one thing that I wanted to talk to you about is, first I want to talk about the Baby Friendly Initiative. I know certainly my level 3 students know about it. Okay. Is this better? Yes. There we go. Okay, better. One of the things I want to talk to you about is a baby-friendly initiative. That's a national program, and it certainly is encouraged by the World Health Organization and the American College of Pediatricians, and AWON, which is for gynecology, obstetrics and gynecology. The goal of that is to have breastfeeding exclusivity with the moms and babies, whether or not it's a latching breastfeeder or non-latching breastfeeder, but the child is only fed breast milk during their beginning of their life. And the other piece of it is that their maternal-child bond, or time, the golden hour, is not disrupted for the family. And that the mother is encouraged to always keep the baby with them. I don't know if you've noticed some of the information in the news, or in talk shows, or on cover of magazines. There's a lot of discussion going on about how long to breastfeed your baby, and should you ever put them down. And they're really telling you that keep your baby with you and keep breastfeeding for as long as possible. So in the hospital, one of the initiatives is for us to encourage that mother-baby bonding. It provides for more stable and increased outcomes for the child for educational, nutrition, and growth and development. Imprinting and bonding is very important. That occurs in the first hour of life. So if you notice, when the baby was born, we put the baby right on her belly. We talked about skin to skin, drying that baby off a little bit, and making sure that the baby's temperature doesn't get pulled away by the vapor of the moisture on the skin and conduction of the wind in the room or the air in the room. But if the mom has a stable temperature and you're doing skin to skin, the baby will have a stable temperature. So that's really important for you to keep that mother-baby unit together. So that's the part of what's called the baby-friendly initiative. It's only a piece of it. The other part is lactation, and it's for hospitals, which Kaleida Health, as well as Catholic Health Hospital Sisters, and is working on this initiative to get to, they're all in phase 2 and 3, by the way. It takes a 2-year process. So no matter which hospital you're involved with for delivery in Western New York, you're going to be exposed to the baby-friendly idealism and how it's encouraged. And it really is something to get on board with, because the outcomes for the babies are much better. So that's breastfeeding exclusivity, golden hour, keeping the mother-baby family unit together immediately, no interruptions immediately after birth for at least an hour or more, and we do everything that we can to help the mom have successful breastfeeding, even if it's teaching them to pump and breastfeed the baby breast milk, or feed the baby breast milk via a bottle. That's even encouraged as well. Okay, the next thing I want to talk to you about is, and I talked to my level 3 students, they can tell you all about it. We just talked about this past week. It's really important that we as nurses understand the impact and the enormity of our profession. And part of that is knowing who to call for help. I say call Ghostbusters, I say call a nurse, because they're the ones with all the information in their head and the information in their pockets, and they're the ones that are going to help you get to, if they can't help you, they're going to get you to the help that you need. A big part of our job is to know where your referral resources are, and when we're talking about the mother-baby world, one of our best resources would be WIC, that's Woman, Infant, and Child. And WIC can be established prior to delivery, but often I find that people will come in and maybe are not prepared with their WIC forms, or they don't know that they qualify. I never make the assumption that they don't qualify for WIC just by looking at them, because you don't know. That's called profiling, and that's not appropriate for our profession. I offer WIC papers and WIC information to every one of my patients prior to discharge, and you'd be surprised how many people are very grateful for that information. Kind of takes a little pressure off their back if they are struggling financially, or if they had to leave their job to have the baby because now maybe this is their second, third, or fourth child, and it doesn't pay to go to work anymore because childcare would be cost prohibitive. So very often it places them in a new position to be eligible for WIC. There's only one time I asked a patient if they wanted WIC forms, and there's only one time in all my several years I've been doing this that they were offended. Everybody's also very grateful. So there are forms that you fill out. It's an easy enough thing to do. If you happen to be clinical with me, I'll show you the WIC paperwork and the forms. But it's really nothing to stress about. That's just one of the services that we can offer to help facilitate a better health for the baby and the mom, make sure everybody's fed and hydrated and have proper nutrients and protein. Very important. The other areas that we talk about is occasionally you're going to run into a situation where there's an adoption taking place. Just know that the social workers are on board with this. Very often, not every time, the patient will come in knowing that they're placing their baby up for adoption. Sometimes the adoptive family's already been selected, and sometimes in the postpartum period or in the delivery room, you'll be dealing not only with the mom and possibly the significant other or the FOB, I call father of the baby, and the new adoptive family. It could be very open adoption. So it's a pretty exciting time, and it's, to me, a very gracious, generous thing to do. And it's a very difficult time. It can be very difficult. But it's an interesting moment if you have an opportunity to get involved with a situation like that. Does anybody else have any questions, any comments? Yes, ma'am.
I'm just curious, I realize the importance of the WIC program, and I'm curious that there are many efforts to promote WIC before the person presents in the labor and delivery room, like to what extent maybe the doctors that are seeing them or nurse practitioners may be promoting the WIC program, because I realize the importance of starting to help.
In general, I know that many years ago when I had my children, probably your age, that was part of my admission process. But like I tell my level 3 students, that you as the nurse, if you're working in a clinic or you're working in obstetrics or maternal child care, that relationship that you develop with your patient when you first meet them is so important to the foundation of how the relationship and the care may go for that mom for the next several months. I say if you have attitudes about certain populations or ideas, check it at the door, because there's no place for that in a maternal-child relationship with a mom. You're helping them to bring another life into the world. So it's really important that you do have those conversations.
No, you should speak. Can I speak loud enough? Can you all hear me? Not gonna hear.
Just hold it like a microphone.
All right, there you go. Okay, so absolutely, before mom's really even pregnant, as a nurse, we're looking at getting them on the right road. So, nutrition, if mom doesn't get enough nutrition, you're going to cut the baby's brain cells by about 50% according to research. Folic acid is huge to prevent spina bifida. We want to look at what kind of medications they're on. A lot of them, especially the mental health drugs, cause autism and stuff. And even diabetes increases the risk of mortality and birth defects by about 400 to 600%. So if we're waiting until 24 weeks, that mom may have already miscarried. So before that baby's even conceived, we're talking to mom in an obstetric or GYN or even a general practice. So it's a practice for any female of childbearing age to have that discussion. So even in my practice, every single patient I see that's under 60 gets asked what they're using for birth control every visit.